Good day, everyone. You're welcome to yet another episode of the Yaba Voice program. We're happy to have you join us. And we get excited each time we start up this program, and then you are there joining us. This support means so much to us. And it also means that, yes, maybe we're doing something really, really good. How are you doing today? I hope you're fine. It's a cool, beautiful day out here in Yaba, the Federal Neuropsychiatric Hospital, Yaba, Lagos. And we have something very important, something very beautiful to talk to you about. But before we go into the discussion for the day, the medical director, Dr. Owoeye Owoeye, will welcome us formally to this webinar. You're welcome, sir.
Thank you very much, Mrs. Kemi Akintoye. Good afternoon, everyone from Nigeria. I welcome you to today's edition of our regular webinar by Yaba Voice on mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. The topic for today is the stress after trauma. The stress after trauma, otherwise referred to as post-traumatic stress disorders. As we all know, exposure to traumatic events can have unimaginable consequences on the mental health of an individual. There can be immediate or delayed psychological response to traumatic events. And the abnormal response to such events could vary from one manifestation to another. In today's webinar, many questions will be answered. For example, we'll look at it. What is post-traumatic stress disorder? How common is this condition? What magnitude of event can lead to this stress after trauma? How do you know that you may be having this post-traumatic stress disorder? That is, how does it manifest? How do you prevent its occurrence for those having the symptom? And what help is available for those who have these conditions? So during today's program, we have two speakers, mental health professionals in their own rights. First of them is Dr. Abdulrasheed Babatunde Awesu, who had his primary and secondary education in Lagos, and then proceeded to the Uthman Danfodio University, Sokoto, where he obtained Bachelor of Medicine and Bachelor of Surgery. He also had his residency training at Federal Neuropsychiatric Hospital, Yaba, Lagos, and obtained a fellowship of the National Postgraduate Medical College of Nigeria. He worked as a consultant psychiatrist in General Hospital, Lagos, in Lagos Island, for a few years before coming back home to join us at the Federal Neuropsychiatric Hospital, Yaba, Lagos. He rose through the ranks, and presently, Dr. Awesu is a consultant psychiatrist, special grade 1. He is a mental health advocate and a clinician par excellence. He's married with children. Also, the second speaker in today's program is a renowned clinical psychologist. He is a licensed clinical psychologist and a registered member of Nigerian Association of Clinical Psychologists. And the person we are talking about is Mr. Francis Akinkunmi. He holds a Bachelor of Science degree in Pure and Applied Psychology and Master's in Science in Clinical Psychology from the University of Ibadan. And at present, he is a doctoral student, PhD student in the same university. Mr. Akinkunmi is an assistant director of clinical psychology at Federal Neuropsychiatric Hospital, Yaba, Lagos. He is also a mental health advocate and is also married with children. Kindly relax as you will listen to our mental health expert today. We promise you a rewarding session in today's webinar. Thank you. Over to you, Kemi Akitoyesi.
Thank you so very much, the medical director, for that arousing welcome. The medical director has told us what we're going to be discussing today. And it's something that is very germane to every facet of our life. I want to encourage us all to please, if you know someone that needs to be heard, someone that needs to hear this, please reach out to them. We are streaming live also on Facebook. So if you cannot connect here with us, please, you can also connect with us on the Facebook page of the Yaba Voice. One word, Yaba Voice, and then you will see us streaming live on that page too. But please reach out to as many people that you know that need to hear this. Trauma is something very significant. And a lot of time, we throw it under the rug and then we just feel we have moved on. But yet, it's like something that is looking to come out, it just seeps out at the end of the day. And so we're going to the discussion for today. If you have any questions or comments, please drop them in the chat box. We will be taking them as we go on in this very important discussion for the day. We will start off this discussion by looking at what is PTSD, or fully known as post-traumatic stress disorder. Dr. Awesu, what is post-traumatic stress disorder? Over to you, sir.
Thank you very much, the medical director, for the introduction, and Secretary for the, the brief, introduction too. The stress after trauma, and once again, good afternoon to everybody over there. Stress after trauma, which is otherwise known as post-traumatic stress disorder, is actually telling us that there's stress after the trauma, as everything does not end with the trauma. So when the trauma ends, there's a lot of things after that. We should know that it is a mental condition that is triggered by severe stressful events. And this event or trauma is of exceptionally threatening or catastrophic nature that can cause distress in almost anyone. But so that means it can cause distress in anyone, but why is it now leading to post-traumatic stress disorder? And the event can be experienced or witnessed. That means there could be an individual undergoing this particular stressful event, or could be witnessed. I'm talking about this witness. It's quite important in this era of social media. Why? Because millions of people witness traumatic events all over the world. About a few days ago, there was a shooting in America where 10 people were killed. We are all aware, some of us actually saw some of these videos and the audio of what is happening. Same thing, something happened in Sokoto a few days ago. Another one in Lagos there, we are all aware. These videos are sent all over the world. So which means witnessing stressful events, you don't have to be there. And it means that the large percentage of people all over the world are actually witnessing these very stressful events. Talking about the stressful events, there are examples of natural disasters that could happen anywhere and everywhere, which include earthquakes, hurricanes, wildfires, floods, tsunami, drought, landslide, etc., which could happen anywhere in the world. And examples of man-made events which could actually occur include wars, combat. Initially, PTSD was actually called combat fatigue or shell shock, because actually it was first noticed among the veterans of the First World War and Second World War. Other events include serious road traffic accidents, multiple accidents on the road with a lot of injury, death, maybe spinal cord injuries, fractured. If somebody is involved or witnessing this, it could lead to actually, PTSD. Plane crash, train accident, boat mishap, rape, domestic violence, fire incident, building collapse, torture, kidnapping, mob action, banditry, armed robbery, terrorism. The list is endless, really. And all these are very, very severe events which actually lead to PTSD. Thank you.
Dr. Awesu just succeeded in whetting our appetite. But you know, when your appetite is, synthesized, it means that something more is coming. But you know, one thing that struck me from what he said is the fact that everything does not end with a trauma. And so that means after the trauma, there is a lot more that can happen. And it's that lot more that we're looking at today. But then again, he said, trauma, when we're talking about trauma, it can either be experienced or witnessed. And do you know that the one that we did not experience, but we are witnessing is even more now? The one you talked about the Sokoto thing, I could not watch the video. Yes, it's all over the social media. But I could not, because I understand what it's going to do. But a lot of people don't. People watch it and then they go to sleep, and eventually a lot of things start happening. And these are part of the things that we're going to be talking about today. How can we? So we're moving on in this discussion. And so Dr. Awesu had told us what PTSD is, post-traumatic stress disorder, and how it can happen, talk about rape, banditry, and quite a whole lot of other things like that. I wonder how the people in the IDP camps are also coping and dealing now with what they had seen and know they had experienced. But Mr. Francis, how do we know what are the symptoms of PTSD? How do I know that what I am going through now is actually what we call PTSD and not as a result of some demonic attack or whatever it is?
Thank you so much, Mrs. Akitoyeshe. Let me start by thanking the medical director, as well as my co-presenter and every listener to this presentation. PTSD symptoms are generally grouped into 4 types. We have what is called intrusive memories. The second one is avoidance. The negative changes in thinking and mood. Then 4th is changing in physical and emotional reaction. These 4 symptoms are the things I'm going to elaborate upon now. I am starting with intrusive memories. These include recurrent, unwanted, distressing memories of the traumatic event. Then it's also reliving the traumatic event as if it were happening again. This is called a flashback. Then upsetting dreams or nightmare about the traumatic event. Then severe emotional distress or physical reaction to something that reminds the victim of the traumatic event. Now, avoidance is another symptom. Avoidance behavior or thought is characterized by try to avoid thinking or talking about the traumatic event. Then you are likely to see the individuals avoiding places, activities, or people that reminds them of the traumatic event. Then we are going to also be looking at not only that, we are going to be looking at negative changes in thinking and mood. And these include negative thought about oneself or other people or the world around them. Then another thing is hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event. Then difficulty experiencing positive emotion, as well as feeling emotionally numb. Then the 4th one, which is changes in physical and emotional reaction, which is also called arousal symptoms, is characterized by being easily startled or frightened, always being on guard for danger. Then it could also proceed to destructive behavior, such as drinking too much or driving too fast. The individual could have trouble sleeping, trouble concentrating, as well as overwhelming guilt or shame. Children, are they also exempted from symptoms of PTSD? The research has shown that no, children from age 6 and below who also manifest these symptoms such as frightening dreams that may or may not include aspects of the traumatic event. Some of them may have a regressive behavior such as bedwetting, and they may also forget how to talk even when they have achieved that skill before. These are some of the symptoms, both in adults and children, that will show that someone is actually
experiencing post-traumatic stress disorder.
Thank you, Mr. Akinkunmi Francis. And you know, the list is endless. I don't know if you have ever experienced trauma in any way. The first time I ever had an accident, I was going to visit my grandma, and right there on the way, you know, the vehicle somersaulted. I found myself on the road, and after everything, there was no vehicle that was coming except a truck. And then the next thing is they said I should come and climb a truck and go to the next village so I can get help. I said, excuse me, I'm not entering. I think my own PTSD started that time, because I can't even imagine getting into a car, you know, at that moment. And so what he's saying is there's this tremor, there's palpitation, there's no nightmare, there's flashback and everything. I kept seeing the car somersaulting, and I was there. I know these are some of the things that people know experiences. Dr. Awesu, with what Mr. Akinkunmi had told us now let's look at how long does it take for PTSD to occur? It's something that people experience just right there at the moment, so that the next time we have a trauma, we start knowing that, okay, the next day or the next minute or 1 week after, 2 weeks or whatever it is, how long does it take for this to now come? Because we're looking at the stress after the trauma. And then who are the people that they're at risk of not having PTSD?
Thank you very much, Mrs. Akintoye. Thank you very much. Actually, the first experience is acute reaction to the stress, really. The PTSD, actually, there is a gap, usually a few days, few weeks, but most within 6 months, you have symptoms of PTSD. But the first thing that actually is the acute stress reaction. You are reacting to that stress acutely before eventually it leads to PTSD. For those who is at risk, really, is everyone and anyone that is at risk, really. And why is everyone at risk? It's because no one is immune from traumatic experiences. We gave all the list of the natural and the man-made disasters, and we are sure we all travel on the road every day by air, by train, and different ways. I'm talking about this because all over the world, it shows that traumatic experience will actually happen anywhere, anytime. So we are all at risk. Even like I said earlier on, even if you are not even at the events, where the thing is happening, because we are actually, we are witnessing it, because it can be sent to our own, even in comfort of our homes and offices. It makes the population so huge being exposed to all these traumatic experiences. I mentioned the issue that happened in America, and one in Sokoto, the one in Lagos. We are all exposed to it, although we are not at that scene at that particular time. But some are at risk more than others, and that's why we can talk about risk factors. That if there's a traumatic experience, who are likely to come down earlier or faster, basically. And the risk factors include personality traits such as introversion, neuroticism, negative emotionality. All these actually increase the risk of having PTSD after this kind of event. Personality disorders too, such as antisocial personality disorder, borderline and avoidant too. They're actually things that actually predispose us to PTSD. Previous traumatic experience, if it has happened before, something similar, and there was no PTSD, if there's another episode, actually, it's actually an increased risk to PTSD. Then history of physical, emotional, or sexual abuse, either in the past, whether in childhood or maybe later on in life, this actually is an increased risk for PTSD. Then previous history of anxiety and depression. If somebody is a known patient, being managed for anxiety or depression, when there's a huge event like that, actually that could be, PTSD could be on top of the already existing anxiety or depression. The history of substance abuse, because this may interfere with the ability of the person to cope with stress of a traumatic event. The substance could do that. Then family history of PTSD, anxiety or depression. Actually, even if the person doesn't have it, but there's a family history, do actually predispose the patient to PTSD or the person. The intense or long-lasting stress or trauma, if it's so intense, I talk about the road traffic accident initially, very massive accident, basically, or long-lasting. Maybe talking about rape now, repeated rape, this person is still undergoing this trauma repeatedly, then it actually is candidate for PTSD. Then poor coping skills, person is not aware what to do, is just confused. It could actually be another factor that leads to PTSD. Then poor social support. The environment, definitely this candidate to actually could easily break down with PTSD. Then female gender compared to the male, find out when they are stressful events, they actually could have a higher rate of PTSD. Then low socio-economic status, could predispose one. And finally, profession, people in the military or paramilitary, policemen, custom who are there, fighting wars or trying to protect the citizens actually are predisposed to this PTSD. Like I said earlier on, everyone actually is at risk. Those are particular factors. Thank you very much.
Thank you so very much, sir. I know what Dr. Awesu had just told us now. He's saying to everyone out here on this call today that no one is immune. When issues of trauma happens, there's this likelihood, there's this chance that you can. And as we're going on in the discussion, we'll be looking at what can we do and how can we rescue ourselves, and what are those things that we can help ourselves with. I recall the last estaaks protest that happened in Lekki, Lagos. Even when some of us were not there live, we followed the series of events, and I knew for 2-3 days I couldn't sleep because of the repeated and the so many images that got stuck in my head. And these are some of the things. So anyone, anywhere. I recall that Dr. Awesu earlier said that trauma can be experienced, or you can also witness it. So nobody is immune, and that's what he said. But he also mentioned some personality traits, and we're going to get back to you on that, sir, because you were mentioning some big grammar, neuroticism, and some other things like that. You will have to break it down for us so that people will know, do they have that kind of personality trait? But we'll come back to you. Now we'll go back to Mr. Akinkunmi Francis, who is going to help us to understand why is it that, okay, now I have seen people who had broken down when they experienced trauma. And I've also seen some individuals who are able to cope. Yes, 1, 2, 3 traumas, and yet they are still functioning. They would even tell you, oh, praise God, God is good. And you begin to wonder, are they okay? So what is it exactly that helps some people? Why do some people experience PTSD? Why some other people don't? So help us to understand that, Mr. Akinkunmi.
Thank you so much, Mrs. Akintoye. This is a very, very crucial junction and discussion. Why are some people experiencing PTSD and some who actually, at the end of the whole thing, did not? We're looking at different factors that will explain this. Some of these factors are individual characteristics. Some of those factors are environmental or contextual characteristics. But let's browse through the presentation, first and foremost, by looking at the personality of the trauma survivor. Individual high in self-concealment and introversion, and low in emotional intelligence are more likely than the other counterparts to develop post-traumatic stress disorder. Again, people who are warriors and negativistic thinkers are more vulnerable to post-traumatic stress disorder following a traumatic event. Another factor that can bring a difference is environment that doesn't encourage disclosure. Survivor living or working in an environment characterized by stigmatization, discrimination, and possibly loss of job or privileges are more likely to hide their pains and trauma. And this could trigger PTSD more than those in an environment that is accepting and non-judgmental. What about the level of mental resilience? Individuals that is mentally resilient are less likely to develop PTSD compared to those who are not. Resilient people are always prepared and able to respond to upsetting events as they occur despite feeling fear. Another very crucial factor that can bring about the difference is how sudden, unexpected, unabated, and abrupt is the trauma-induced stimuli. And that is very, very important. Also is the number of traumatic events and their duration, how many traumatic events the individual is experiencing, and how long could make a difference between those who develop PTSD and those who did not. Attitude towards the traumatic event, reacting or responding could make a difference. Those who react to events are more likely to develop PTSD compared to those who respond to the traumatic event. There is no single factor that actually explains it. A combination of factors could explain why some will develop and why some will not develop. What about history of mental illness, both in an individual or in the family? Individuals with history of mental illness or from a family with history of mental illness are more vulnerable to developing PTSD than those who are from a family without history of mental illness. Willingness to seek help, people who seek professional help following traumatic experience are less likely to develop full-blown PTSD. As the saying goes, a stitch in time saves 9. This is also another factor. Then joining support group and utilization of support system. People who have readily available support system who could assist them following traumatic experiences are more likely not to develop PTSD compared to those without social support. Now, it is also important that strong emotional, psychological, and spiritual coping resources can make the difference. And many of these things are some of the factors that could make a difference between those who develop PTSD and those who do not. Finally, I talk about unresolved childhood traumas. Individuals who are already traumatized in childhood and who were unable to adequately deal with this conflict may likely come down with PTSD than those without unresolved childhood traumas.
Thank you so very much, Mr. Akinkunmi Francis, for that elaboration on why some people would break down and why some other people would not. And he had told us there are some that are, yes, internal, inborn, the mental resilience, the support, your own mental attitude. And there's something they said, which seems very germane, and which is, do you react or you respond? And I'm still going to come back on that, because you will have to maybe explain to us, how do you react? Because I was wondering when you said that when a traumatic event is happening, do I just prepare myself to respond and not react, or to react and not respond? You would help us to maybe understand that when we get back to you again, sir. All right, so but then he now mentioned something which is also very germane, and it's the fact that unresolved childhood trauma could also predispose an individual to what we are looking at, the PTSD. And so, Dr. Awesu, do children react differently than adults when we are looking at these issues? And if yes, what are the differences that we are looking at?
Thank you very much. Quite difficult to identify.
All right, I'm sorry about that. We're sorry, it's a bit of technical itch, but we're trying to resolve it. Dr. Awesu is coming back on.
Hello?
Okay. All right, yeah, we can hear you now, Dr. Awesu.
Hello, thank you very much.
No, we can't.
Hello? Hello, good afternoon once more. Okay, we are talking about the children. The children, did they react? I need to see. Did they react differently from adults? And like I said earlier on, I want to see this. Hello? So like I was explaining that actually whether they react differently or the same way as adults, like I said, the reaction actually could be, the answer could be yes and no, because there are some symptoms that actually, they are like the adult. Meanwhile, there are some other symptoms that are a bit different really. Symptoms like hypervigilance, the flashbacks, insomnia, they are seen in adults, actually seen in the children too. But what is peculiar with the children actually is that it's difficult to actually see, to actually diagnose the PTSD among children. And why is this so really? Because sometimes the children are not aware of what is happening. They are not aware about these, about these symptoms because of their age and the maturity. And even when they are aware, they cannot express themselves clearly. So it's quite difficult to actually, recognize PTSD in children. I want it to have a high level of, trying to get this thing among children. And we can remember, actually, for children 6 years and below, PTSD was not even diagnosed among them until DSM-5 recognized this one in 2013. The other symptoms that actually children could feel include poor attention and concentration, so they may not be doing well in school. They are irritable and aggressive among their peers. There's restlessness, bedwetting, acting out the trauma in play. When they are playing, you can see some of their play. They're acting out will actually show, they have a history of trauma. Then clinging to parents or caregivers can be seen among them. Then risky or destructive behavior too can be seen among these children. What is actually, we should notice that for teenagers, because usually as children grow older and become teenagers, the symptoms look like the adult own. But it has been found out that actually the aggressiveness in teenagers is more than children or even those who are older adults. But the good news about children is actually that PTSD is easier to treat among children. Why? Because the brain is still developing. And actually somebody could outgrow these symptoms, and actually when they are actually caught early. But the problem which I mentioned earlier is that it's quite difficult, for you also to be able to recognize PTSD among children. So there's has to be high level of suspicion then to be able, suspicion to be able to pick it among the children. Thank you very much.
Thank you so very much, Dr. Awesu. I want to apologize for that technical itch. Some of this time, we can't just control everything. And, funny enough, the power holders decided to also take their light. And, the gen will come up soon. The medical director is here, so they must give us light. But then just hold on, just accept us as we are. But please listen, and so that you can get the best of information to take away from this webinar. And what Dr. Awesu said is yes and no sort of question that the children and adults have similar symptoms when you talk about PTSD, or it's different. And he said yes, there are some that are similar, there are some that are specific to children, but then we must be very, very, he used one English, high index of suspicion. And what that simply means is you must know, you must be familiar to be able to understand it. Otherwise, you just disregard it. You see it as something that is normal, or you even see the child as pretending. You know, the child doesn't want to go to school, the child is bedwetting, and you say, hey, you have started bedwetting again. It's because of the play that you are playing. No, we must be sensitive to all of those things as parents to be able to pick them up and to be able to see what we need to do about them. So don't just discard anything. Be very, very mindful of changes that happens even among your children. Yes, children do also experience trauma. Gone are the days when they say, kill Omodemo. Omode knows a lot of things now. They know quite a whole lot of things, and they go through very many things. And don't also forget that childhood trauma could be a precursor for adolescent psychiatric problem or major distress that could happen in life. All right, so we'll also be looking at this next question. It says, what are those things that people can do when they find themselves in, or they had experienced traumatic situation, you have witnessed or have observed or have experienced or whatever it is? What are the things that people can do to be able to cope, to be able to deal with it, and so that they can be able to get out of it? Are there self-help tips, Mr. Akinkunmi Francis?
Thank you. Cope with the situation. One of it is speak a positive affirmative statement. Where following a traumatic event, engage in speaking, confessing positive affirmative statements. For example, you can engage in saying that change for the better will come. Help will arise for me. This tough time will pass away. I will overcome this situation. Winning is my portion. The word you confess and you keep confessing will eventually become your reality. For those adherent believers in Quran and Bible can also start confessing the promises of God at that moment, and it will go a long way in helping them to cope and overcome the situation. Practice gratitude and forgiveness. Since you survived the trauma and you are still breathing, see reason to be grateful to God and to men who are available to support you. Such gratitude mindset could provoke positive emotion and optimism. Conversely, let go of hurts from the perpetrator and forgive. Total forgiveness gradually heals trauma. Another factor, another tips you can engage in is to connect with good people, friends, co-workers, family members who are not perpetrators, who can act to support you financially, emotionally, spiritually, etc. Sometimes there may be need for you to change your environment when necessary, especially if the environment is where the perpetrator is living. Living with the perpetrator will worsen your condition. Changing an environment could also help. Seek for knowledge and change your attitude. Read more when possible about PTSD and emotional intelligence. Also practice emotional intelligence. Then change your attitude to the trauma. Learn to respond rather than reacting. Responding includes seeking the way forward and the solution to the trauma. Practice deep breathing and other relaxation techniques. Avoid undue fasting and vigil, because some people do think that such a traumatic event is spiritual. So they start engaging in undue fasting and vigil, which could be counterproductive. So avoid undue fasting and vigil, avoid alcohol, cigarettes as a way of coping with a trauma. What about seeking professional help? You can visit or call on competent professionals, either psychiatrists, clinical psychologists, to come to your aid at this time. Combination of all these strategies will go a long way in helping an individual not only cope, but also be able to bounce back following a traumatic experience. Thank you.
Thank you so very much, Mr. Akinkunmi Francis. You're going to tell us how we can do deep breathing exercise so few minutes. But like I said, I quickly want to, before we move on to Dr. Owoeye, you have said again, respond rather than react. Just in 1 minute, what does that mean? Mr. Akinkunmi Francis, we say respond rather than react. How do people do that? Somebody has abused me, slapped me, bullied me, did it, or have witnessed something, and you're saying I should respond rather than react. So what does that mean? Help us to understand that.
Thank you so much, Mrs. Akintoye. Following any event, either traumatic or otherwise, an individual could either respond or react. When we are talking about responding, it has to do with seeking for the solution, seeking for the way forward to the situation and the challenge at hand. What can I do to solve this problem? How can I turn this experience into celebration? How can this experience be turned from a stumbling block to a stepping stone to a higher ground? That is, an individual is taking a proactive measure to solve the situation. An individual who is reacting to it is someone who, for instance, may not even think before acting. Such an individual is focusing on the problem, is being weighed down by the problem, is looking directly on how the problem is affecting his or her life. That is not a good step, but the better step is to respond, seek for the way forward, look for the solution, how to get these things solved. And sooner or later, there will be ways, there will be solutions. Thank you very much.
Thank you very much, sir. And so what I hear him say is you have to be proactive about it. You know, it just goes with what the English band will say. You don't cry over a spilled milk. Yes, it has happened. This is ongoing. That has happened. You couldn't have controlled the situation at that point in time. But now you're here. You can control your reaction. You can control the effects that you feel. You can control your thoughts. So you have much power now to be able to take over and deal with the situation. Dr. Owoeye, before we go into this other question, there's this question on the platform. Please, people on the platform, know that you can send your questions and your comments to the platform. We will be taking them as we go on in this discussion. From Dr. Mustafa Sombe, it says, congratulations to the presenters and participants. And the question is, COVID-19 ripple effects are traumatic. How does it fit into PTSD? Does it fit, Dr. Owoeye, does it fit into what we're talking about here? And if it does, what can people do? How can we begin to get out of this ripple effect of COVID-19?
It does, definitely. Thank you for the question, Dr. Sombe. Because basically, PTSD is reaction to a very severe event. And when you're talking about the COVID-19, some people lost their lives, lost their loved ones, lost their jobs. I mean, some getting back to their life, really. So it's actually fitting perfectly to PTSD. And what do we do at that point? Even they have a very elevated illness from this COVID-19. Main thing actually is having a resilience skills, which we'll still talk about. But the other thing to look for help from the professionals, basically. When you notice some of these symptoms, really, you should look for help, really. That's actually what I thought most people actually do. And actually, going back, if you have record, it's likely there's an increase in number of actually people coming down with some of these symptoms than before, during the COVID-19. And I'm sure a lot of research has been done on this, and that a lot of mental breakdown during that COVID-19. And even now that we are coming out of it, some are still, going through some of those symptoms. So it actually fits in very well. Thank you very much.
Thank you, Dr. Awesu. I remember the first time I had to come to work, I used a glove, I used mask, I used cap, I used virtually a whole lot of things because the fear was just too much. Everybody was just saying it's all over the place, it's in the hair. So you don't even know the next person that sneezes or people talk to you. It was really, really scary. And some people haven't even gotten out of it because they lost their job, the source of livelihood and every other thing. So it's really germane to what we are talking about today. Before I still go on to this issue of resilience that Dr. Awesu is going to talk about, Mr. Akinkunmi Francis, somebody sent a personal question to me and he says, when you're in the midst of continuous trauma, this trauma is repeated and it's continuous and you're beaten down, you are down. He said, what can you do? How do I not still react? Well, how can I keep responding in line with what you have just said? Please note that we will not take personal comments. Just send your questions to the chat box and we'll be able to take them as we go on. Thank you. Mr. Akinkunmi Francis.
Thank you. Thank you so much, questioner. And let me also thank Mrs. Akitoye for that question. The truth on ground is this: there is no one single strategy that is enough to solving a traumatic event. If you are inside a traumatic event and it's unabated, a time will come whereby your psychological resources may become depleted. And if care is not taken, your mental resilience will wear out. It is important in situations like that, one, to, if possible, change the environment, leave the environment. In leaving the environment, you can regain, rebuild your psychological resources and strength. Then in addition to that, you don't need to carry the whole load alone. Seek help. You can connect with professionals who can teach you some strategies to overcome the situation. In other words, you can connect with friends, but it is important that that environment that is anxiety-provoking, traumatic-provoking, you first of all get out of that environment so that you can gain more strength to carry on with life. Coupled with other strategies I've talked about, you can actually bounce back and you can experience post-traumatic growth, which is very excellent if you can get there. Thank you very much.
Thank you so very much, Mr. Akinkunmi Francis. What I hear him say is you can leave. You don't have to keep staying there. You don't have to remain there. Sometimes we don't see alternative, we don't see options. And that's what makes us to remain in very traumatic situations. So please leave. There will always be a way out. There will always be something that you can try. There will always be something that you can do. And again, you said you don't have to carry the whole load again. Somebody else is there. And that's why we are here at Yaba Voice. It's what we do at the Federal Neuropsychiatric Hospital, Yaba, Lagos. We help, we find solutions. We give you skills that helps you to be able to cope and to be able to do so well, even with your life, even despite the trauma. Yes, he just talked about post-traumatic growth, and then he can talk about it again, even before we round up. And so I'm going to go to Dr. Awesu now. And are there resilience skills? I hear Mr. Akinkunmi earlier talked about mental resilience, and maybe you should just help us to understand what are this, when we talk about resilience, when we talk about are there resilience skills that individual can develop or adopt, grow with, or whatever, that helps them to be able to now deal with or cope with adversity adequately. Thank you, sir.
Thank you very much. There are actually, and resilience just means something you want to do that will be able to actually make you cope or even prevent some of these things happening. And there's quite a number, just like Mr. Akinkunmi said, there's no single way to this thing. There's so many ways, so many factors that actually, you can combine together. But the first thing actually is to be in good health. Even before any stressful event, you should actually keep yourself in good health, physical, mental, and social well-being, which can be done by balanced diet, good exercise, good sleep, good interpersonal relationship. You are supposed to be prepared, for any event, and by being in good health. That is one thing that everybody needs to actually key in, which is very, very important. Another thing is to be being resourceful and having good problem-solving skills. Seeing any event as a problem that can be solved, really. And that's where the issue of actually responding comes in. I mean, you don't see that it's the end of everything. What is this problem? How can I go about it, really? I'm assuring that actually sitting down and thinking about it, you like to have solution or looking for help, eventually if you cannot do it on your own. Then knowing your strength and working with it, basically, is quite important. You have to be aware of your strength in different conditions, and that will help to actually be able to overcome this event. Then there should be self-awareness, which includes knowing your strength and even your weaknesses, and how can you cope with things generally. And environment awareness too. What's happening in your environment, you should be aware and you should take cognizance of it all the time you are. I mean, you should be able to actually be aware of your environment. You can't just not be aware of the environment because anything will happen around that particular time. And you should actually manage information very well. And that actually reminds me of the issue of the COVID-19. We get so many information. Some are just news. Some people just post it. And some of them are things actually that should get information from the reliable sources. And then this issue of sending video or reading anything that comes, there's some video. In fact, they will have warned you. I mean, this is a very traumatic event. What will you gain by actually opening it? So these are things you have to manage information very well because some actually could lead to traumatic event and PTSD. Like I said, many people have this problem now because of not being there. It's just because we are witnesses, because it can come to you in the comfort of your home or even your offices, really. Then all the time, think positively. That is a factor. Whatever the condition, think positively. How can this thing get better? And find a positive meaning. Even in the trauma, what can you learn from it? That should be the way. What can you learn from even this trauma, and how can you actually be able to cope with it? Then take stock of previous adversity and how did you survive? I'm sure this is not like to be the first one. So how did you survive? And that will actually give a lot of confidence and you'll be able to move ahead. Then connect with others, which has been mentioned earlier on. That's good social support. You should actually be there before you even have any event that actually putting it, under this stress. That should be well connected. And that will be found to be a very positive attitude toward surviving in life. Then helping others. The science have shown that helping others too will actually make you to be able to think less of your own problem and be able to forge ahead. Then refuse to give up. Whatever condition, refuse to give up at all these conditions will help. And then identify yourself as a survivor, not as opposed to being a victim. That actually helps very well. Then whatever situation of things, seek help. It could be family, friend, professional, and support group. And finally, spirituality has been known to help, really. Having a belief in a greater being that could actually helps you to be able to overcome a lot of distress. Thank you very much.
Thank you very much, Dr. Owoeye. So I wish we had time and you will be able to talk so much about all of these points that he had mentioned out to us this afternoon. But, I hope you have been able to take one or two things home. But then, he said, don't see yourself as a victim. See yourself as a survivor. You are a survivor. And he said, yes, spirituality, whatever religion you belong to, has also been found to give people hope, confidence, and every other thing, even at this point in time. But be positive. In this time too shall pass. It's a mantra that we all use. It's a phase. It will go away and never. But then, Mr. Akinkunmi Francis, quickly, we're running out of time, and I want us to take a lot of questions here. Can PTSD be avoided, be totally avoided? That's the word. In one minute, Mr. Akinkunmi, can PTSD be totally avoided?
Thank you, Mrs. Akinkunmi. The answer is yes. It can be avoided. The answer is yes. It can be avoided. The truth on ground is that there are so many people in this life who has witnessed or experienced traumatic experience in the past, but yet without symptoms of PTSD. Why? Is because some of the ingredients we have talked about before, possibly being mentally resilient, possibly connecting with people, they have been able to utilize it or even seeking professional help. And at the end of the whole thing, they have turned their lemon to lemonade. They have not been able to even experience.
Thank you so very much, Mr. Akinkunmi. We'll have to just round up here. But thank you so very much. Dr. Awesu, what advice will you give to a client with PTSD and the use of sedative?
Thank you very much. Thank you very much for the question. Basically, one of the symptoms of PTSD is it's insomnia, which is poor sleep. And of course, people who don't have good sleep in night will look for solution really. But sedatives are not things that actually should be bought on the counter really. It should actually be prescribed. So if it's really if the stomach has gotten so bad, I think you need to see a professional, you need to see a doctor, because it's a drug that could easily be addicted to. So that's why it needs to be taken with caution, really. Then I'll probably say something on the last word, which is mainly trying to prevent PTSD, because it's better to prevent than trying to take care of the symptoms when they are there, really. The first, that the sources of trauma should be minimized as much as possible. And that means we are all hands must be on deck, really, because it involves individuals, families, communities, government, in all countries, international organizations, because crimes, road traffic accidents, war, they are all issues that actually cause this. And everybody has to actually put their heads together to be able to know they want a peaceful world. And when that is there, then there will be less trauma. And if there's less trauma, there will be less PTSD. For those who have it already, is to look for help, and it's the job of mental institutions to actually educate, support, and treat. Thank you very much.
Educate, support, and treat. Oluroti Ojelade, if peradventure they are manifesting symptoms of PTSD, or you feel it's still affecting them, you can easily bring them here. They would assess them, and then they would see if there is a need for further psychological intervention, and they will be able to do that. There is no harm in bringing them in here, especially if you know that might also be affecting them. Ishmael, Yakin, thank you so very much too for being on this call with us. Mrs. Owoeye, thank you so much. Teresa Moses, Oluyemi Abayomi, and George, thank you so very much, everyone. To Gilaro, yes, we appreciate you for also being on this call with us too. We so very much appreciate you for coming. And so we'll be coming to the final note on this platform. In one word, Dr. Awesu, what do you want our people to go home with? One word, sir.
To actually improve our own resilience skill, for that is under our own control. Basically, the other thing, the trauma still may not be under your control. Protect yourself, know the environment you are, and actually improve your resilience skills. Thank you very much.
Thank you, Mr. Akinkunmi Francis. In one word, take home.
Thank you, Mrs. Akintoye. Let it be known to our people that change is a permanent thing. Whatever you are going through now, there will still be a positive change in the future. Thank you very much.
Thank you so very much, everyone, once again, for being on this call with us. The stress after the trauma. You can imagine there's a stress after the trauma. And that's what we have looked at today, the PTSD. And this month, we had the Mental Health Awareness Week, and we looked at loneliness. And we shared out some things on the Yaba Voice platform, the different platforms. So if you have not checked, if you have not looked at it, please go there and see what some of those tips that we have shared on loneliness. And that's why next month, by the grace of God, we'll be looking at loneliness and old age. What are the mental health implications, and what are the solutions? How can we help? Because we know this is also something very germane, especially to that age category. Some are not even prepared for it. And so it goes down with a whole lot of other things like that. So we look at the mental health implication as well as the solution today. So please watch out for this next month by the grace of God. And so on this final note, I'm echoing the thoughts of the medical director and the words that he has also sent to this platform. We are encouraged by you. We appreciate everyone on this platform. Thank you for your time and your resources. May the good Lord bless you. So on behalf of the medical director, Dr. Lubenga Dekile Owoeye, and every other member of the Yaba Voice team, I want to say thank you so very much for always finding time to be here on this platform with us. Until we come your way again next time, please keep safe. Ensure that you flourish. Keep your mental health prospering. Respond rather than react. Build your mental resilience and just be the very best. This time too shall pass. We will definitely overcome. Until next month, take care. Bye-bye.